What's going on? It's your man BSwift, and this is a episode of Guy's Guide. It's been a while since we did one of these, and I'm glad to be back in this chair. And today I got a very special guest as we bring you the Guy's Guide inside of the Inspire You universe, being brought to you by Eskenazi. And sitting on my left, Benjamin Tapper. What's going on, family?
That's good. How you doing?
Chilling, man. Now, I want you to tell everybody your title.
Absolutely. So I serve as the Chief Diversity and Equity Officer for the City of Indianapolis.
That's dope right there. Now, explain to people what that is, because they're probably like, what do you do down there in the office?
Most days I'm asking the same question. So I oversee our Office of Equity, Belonging, and Inclusion, which was created in 2023. And our job is to kind of guide the strategic DEI vision for the mayor and the city-county enterprise. And so put simply, that means we're looking at the city-county workforce or the city-county enterprise as an employer and asking ourselves, what can we do to be more diverse, more equitable, and inclusive for the people that work here? And then secondly, I'm looking out at Marion County and saying, hey, where are the gaps in equity? Which segments of our population are suffering or need more support? And how can we use city resources to collaborate with the community and close those equity gaps?
Now, that's very dope. And let me say this. I've had a great relationship with the mayor's office. That's one of my guys right there. Love when I get a chance to see him. And then we're wrapping up 2024. So I ask you, do you feel like the year of 2024 was successful for you guys' mission for what you do?
I'll say yes.
Okay.
You know, and it's interesting being in this position because I've been in this role 2 years now. Before I was in it, it didn't exist. My agency's been around about a year now, and so all this work is fairly new for the city. And so success is measured a little differently than it might for another city department or agency. But I'd say for us this year has been successful because we've been able to stand up some of the programs we want to stand up. We've been able to kind of do the planning and lay a good foundation for this work in the city-county enterprise so that it will last long after I'm gone, long after the next director's gone. And I think we'll be able to continue to build upon that year over year.
No, and I think that's dope. And talk to me about some of the things you have done this year that stands out and that the community can be like, oh, I know what that is. I didn't know that happened like that and with you guys. What were some of the programs that you felt like worked or that stood out and continue to be successful?
So we've been able to stand up some unique training opportunities in the city-county enterprise this year. I have a training manager named Shayla, and she's been able to do a phenomenal job creating DEI trainings for agencies as they ask for it.
Dope.
And when I say a DEI training, people usually think of diversity or they think of implicit bias or anti-racism, and those things are part of it, but we're also looking a bit broader, because to me, DEI work is about relationship.
Absolutely.
It's about culture. You can look at policies, that's fine. You can look at demographics, that's cool. But if you ain't working on the relational level, you're not shifting dynamics, you're not shifting culture, and the work is going to be ineffective. And so for us to be able to do these trainings and then zoom out, we're giving people lessons on implicit bias, but we're also kind of helping people think about how do you coexist in your department together better? How do you be intentional about how you're engaging with community members so you're coming at it from a culturally sensitive perspective? And so I'm really proud of the training program that we've established. We've also been able to do some language access work. As I'm sure you know, Indy is more diverse every day.
Well diverse.
Every day.
Depending on what side of town and more diverse than the others, right?
Listen, if you're at West 38th Street, you wouldn't know you're in Indianapolis.
I'm a West Side guy, and sometimes I'll be like, man, okay,
right,
bet. I like where we're going with this.
It's beautiful. But as we diversify, local government has to be intentional about making sure we know how to meet our citizens' needs. A very small example, when the pandemic hit back in 2020, local government quickly realized we didn't know how to communicate with people that English wasn't their first language, right? Or if Spanish wasn't your first language. Can we translate our resources and information about COVID into Haitian Creole, into the Chin dialect? Maybe, maybe not, right? So the city had to scramble to figure that out. And since then, we've been trying to figure out how to do that language access work better. And so this year, we were able to solidify our language access plan that'll be rolling out next year. And so that's going to cover, how folks in city government access translation services, how they get interpreters at their meetings or events when they need it, who's going to pay for it, what organizations can we use, can employees get bonuses for speaking more than one language, like those sorts of kind of nitty-gritty details of how the work gets done so that we can get our residents the information they need.
And I think that's dope. Like we was talking earlier, I got an 8-year-old daughter, and it's amazing for my kid. Like I forget what this app is. David, you know the app because you be on the app. David, Duolingo.
Okay, yeah.
And the kid surprises me because she'll come and she'll be like, hey, I'm learning German or I'm learning Spanish. And I'm like, what,
yeah.
how? She's like, well, Duolingo, I got an A, I passed this flying cousin. I'm like, Cool. We're gonna set you up and make a lot of money when you get older, because I don't think you understand what you're doing. Like, and I've always said, well, when she get older, I want her to learn sign language, because it's a great, because people need it. There's somebody needs an interpreter for different things. You know what I mean? So to know that the city is that head on and thinking about that, because again, you're on the west side. The population, the makeup is so different. When you come north side or downtown or south side, it's people everywhere of every color, of every ethnicity. And it's just like,
it's wild and beautiful.
It's amazing.
And this generation, I mean, to your point, like, I think we're probably close to the same age. I'm 36, right?
Okay, I'm 40.
Okay, so growing up, I had an awareness of diversity, right? And I knew, I grew up around different people, but it wasn't as ingrained as it is for my kids, right? Like, my kids are growing up going to school, hella biracial kids, hella multiracial kids. You know, they're gonna have folks speaking Southeast Asian dialects, South American dialects, Eastern European dialects. I didn't have that.
Facts.
Right, and so for them, this is just life, right? It's not something they're learning. This is just, oh yeah, I'm in an interconnected world, and that's gonna shape how I move and what I think about. And I think that's beautiful. But government has to be adaptive to it. I'm sure in radio and the entertainment business, it's similar, right? You gotta know how to reach your market and communicate effectively with them. That means being aware of what the needs are.
No, absolutely. 2025's on the way. What are some things that you guys are working on? Because again, the rollout's been great. You guys been doing a great job at this. What can people expect from you in the new year?
I think the biggest thing that I'd want us to work on in 2025 is around health equity. You know, health equity is an often overlooked aspect of DEI work, I think. And if we look at different metrics throughout Indianapolis, whether we're talking about heart disease, diabetes, hypertension, maternal mortality, and infant health, segments of our population are suffering a lot more than others. And so I've been really working to try to connect with the healthcare institutions in Indianapolis to think about where the gaps are in equity and to see how the city can support, whether that's standing up programs, sharing resources, like whatever that means. So health equity in general, more specifically, I want us to be able to do something around infant mortality. And
that's huge.
Huge. You know, there are 13 zip codes in Indy in which the infant mortality rate is double the national average.
Are you serious?
Yes, and if you are a black family, there are 4 or 5 zip codes in which for black families, at least as of 2021, 2022, it was 4 to 5 times the national average.
Oh, wow.
So these are epidemic crisis levels for some of our families. And so we've been having a lot of conversations with healthcare providers, researchers on what do we need to do to address this here in the Circle City. And I'm optimistic that next year we'll be able to stand something up to help begin to hopefully close that gap.
Because that's alarming to know that these numbers are that high.
It's tragic.
Especially for a lot of different communities. And I know our communities, you see, like now I see women online preaching, hey, get a doula, get a doula.
Yes.
Because I don't want to say the hospitals don't care, but that's what they say. You know what I mean? And hey, we're black women, you should get a doula to make sure, because our numbers, and I never knew they were that high.
Yeah.
That's alarming.
And to your point, the community knows the barriers they're facing.
Absolutely.
Right? And this ain't a knock on our healthcare systems, but we know across the U.S., healthcare systems have not always treated black and brown folks fairly, and black women have borne the brunt of that, right? Whether it's not believing they're in pain when they're in pain, or us putting barriers to them getting access to healthcare when they need it. This has led to black women dying from childbirth far more than any other group except for indigenous women, right? And so I hope people working in healthcare hear that not as a criticism, but as a call to action, right? So how can we come together and really support those that need the support?
Yeah. And what am I? I know there's probably a lot of people watching this that are second, third generation, brown, Hispanic, and you know they have a thing about going to the doctor because they feel like they're not going to be helped. Yeah. And that's another thing that this program is also covering, making sure that they're comfortable. Correct?
Yeah, I mean, I think a lot of our healthcare institutions are doing a much better job at that language access piece, right? And language access is more than just having a machine translation or using Google Translate, right? It's about having people there that understand the meaning behind words. You know, put really simply, if you go to like Hallville, right, and you're talking, you can say, hi, how you doing? And that is in standard English an acceptable way to greet someone, but that's probably not the way most folks are going to greet each other if you're in Hallville, right?
How you what, nasty? What's up, bro?
You know, Google Translate ain't going to know that.
Yeah.
You need someone that has been in the culture to be able to accurately translate what you're trying to communicate. And the same thing for other languages and dialects. And so I think our healthcare institutions are getting better, but as the city stands up its language access program, we are absolutely here as a resource for others that are trying to do the same. And we'll share whatever information we've got so that they can better improve their programs too.
When you took this job, did you know what you was getting yourself into? Or was it like I don't know, let's open the door and figure it out as we go along, but I'm here to help and build something? Because what you're a part of now, in 5, 10, 15 years, when we look back at this, it's gonna be like, yo, he understood and he helped be a part of something that was needed and amazing.
I'd say it's both, right? I was a DEI consultant before I took this role, and so I had enough of an understanding to know the breadth of it.
Yeah.
But you don't fully know a thing until you step in the door, right? And so I didn't fully know the city-county enterprise until I stepped in the door. And as I'm in this role, I have a different vantage point of different segments of our community and different populations, and so I'm understanding the diversity of need in different ways. I would say, though, it's been more or less what I expected, which I really appreciated. And I came into this job thinking it'd be a job I could do on day one and one that would really challenge me and force me to grow. And it has definitely challenged me and forced me to grow.
And speaking of challenges, of course, when you speak DEI, you got some people that frown up.
Yeah.
Do you find yourself facing those pushbacks where it's like, I don't care about y'all being mad. I'm not stopping what I'm doing because it benefits everybody, and you just don't understand at this moment, and give it time, you will get it.
Yeah, it's a fine line to walk, right? Because, internally, as a black man, as a biracial man, there are moments where I really want to be like, hey, I'm sorry about how you're feeling. This is what it's got to be. You're going to feel how you feel, and that's okay. But as someone representing an institution that is diverse, right, I have to be aware that I haven't always been here in this role, right? I haven't always had the beliefs I have, and I've needed people to walk with me in grace and in patience and with wisdom so that I can get where I've gotten. And so I've got to be able to bring that to the enterprise and the people I engage with as well. So yes, there's part of me, the part that hurts for those that are suffering and will continue to suffer until we figure this out, that wants to be impatient. But there's another part of me that remembers that when we're dealing with people, we're complicated, we're complex. I'm complicated, I'm complex, I'm messy. And the grace that I know I've needed to grow and evolve, I got to find a way to create space for others to get to experience that as well. Now, everyone may not want it. Like some people will never be interested in shifting and growing. That's fine. But though there are people that are, and sometimes you don't know when someone's going to be ready. So you just got to keep the door open, and then one random day, they'll suddenly walk through it and be in the room with you, and you're like, oh, all right, cool, you're here now. Let's
Welcome to the program, baby.
Right? Yeah. But if the door's not open, you might miss that opportunity.
Nah, absolutely. And I think that's the best part, is leaving that door open. Like you say, they'll find their way in. Yeah. They'll stumble in and with their head down and, we no judging. Come on in. You know what I mean? And we welcome you to be a part. And I think that's the dope part.
And they don't have to understand it all to come in, right? Like, your access point might be language access, right? You may not fully understand any racism, but people need to be understood.
Absolutely.
And so that's what you care about. Or maybe your access point is health equity or environmental equity. Come in through the door, through the window, through the crawl space. I don't care how you get in.
Just
Once
get
you
in
here, we can figure the rest out, right? Just get in.
Nah, that's dope. Now, I'm sure somebody's watching this and is like, yo, I love this. Are there things the community can do to be involved or to help or to be a part of or to give suggestions? Are there things, or it's just like, oh, we got it, we doing us?
No, there are absolutely things the community can do. And equity work is inherently communal work, right? It has to be. And I want us to be able to be better at community engagement and outreach in 2025. Frankly, it's been difficult because for the first year, I was a team of basically one. This year, there's up to 3 or 4 of us, right? But for a city of nearly 1 million and a workforce of 7,000, it's still not a lot of people, right? So we haven't been in the community in the way that I'd like us to be. But I'd say in 2025, we're going to be doing more public events centered around health equity. And so we encourage folks, if there's an event in your neighborhood, come through, talk to us. We want to listen. We want to hear what's going on. If you have questions or ideas or suggestions, we have an email inbox called equity@indy.gov. They can just email that and reach out to someone on my team, and we'll get back with them. If there's organizations working in the spaces of language access or DEI training or health equity and they want to collaborate with us, they can reach out to me, email equity@indy.gov, and we can start talking about what collaboration could look like.
And I love that, and I'm glad you came today, because I want to make sure 2025 we sit down, we talk more, and we collaborate, and we help get the word out to some of the things you got going, because it's very important to the metro area to be a part of this. You know what I mean? I know for our station, we touch so many different people.
Y'all do.
I get the phone calls, and I'd be like, okay. Where are you from? You know what I mean? And they give me, I'm like, oh, okay, I didn't know. Or when we're out at events and you see the faces and they like, I listen. And I'm like, okay, this is dope. You know what I mean? So I definitely want to find out how we can be partners in 2025 to help expand this mission and the voice and the footprint of the DEI work that you guys are doing at the office, because again, for the city, for the state, it's needed badly.
Yes.
It's really, 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 really needed. Again, when you look at Indianapolis and the way it's growing and flourishing and the people that are here and the communities, like, I think for me now, the Haitian Day that they do is amazing. Being the age that I am, and in the last couple of years learning that the Haitian community is as big as it is in Indianapolis, to where now they celebrate with an event at a park or at a stadium. It's crazy. And I'm like, okay, wow, who else is here now? Like, I didn't know all these people was in Indianapolis.
And who would have thought? Like when I moved here in 2012, I couldn't have guessed we'd have a large Haitian population, or the Burmese population we've got.
That's another one. People don't understand how large it is. The Burmese population is very huge here.
I think it's either in the state of Indiana. I think the state of Indiana is the second largest Burmese population outside of Myanmar and Burma.
That's crazy.
Indiana, wild.
That's wild to me. And people don't know it because we don't see it, or when we see it, we think or we judge, not knowing that, hey, they looking for the same opportunity we're all looking for.
Absolutely.
And it's on us to help. And like you say, it's a language barrier there, so let's figure out how to help that language barrier. You know what I mean? And I'm glad that you shedded some light on that today, because it's very important, I think, for people to know that it's a lot of people here. And there are people trying to help and give the access, and what you guys are doing at the office is amazing.
And we don't have to be afraid of the diversity. We don't got to be afraid of people that don't speak our language, because at the end of the day, everyone wants strong families.
Facts.
Everyone wants strong neighborhoods. Everyone wants healthy food, healthy air, healthy water. These are common things that unite us all. So we got to figure out how to communicate better, how to find the alignment, and then once we find that alignment, how to collaborate and partner. And so I'm hoping that with the work you're doing, with the work the city's doing, with the work nonprofits across the city are doing, that 2025 will be a year of collaboration in the Circle City, and it'll lift us all up.
Listen, we down to help, and again, all of you out there watching, you heard him. Collaboration is the word.
Absolutely.
Being partners is the word. If they want to collaborate or find out more, get you guys to events. Give them the email once again.
It's equity@indy.gov.
equity@indy.gov. They answer it. They will get back to you.
Absolutely.
Definitely hit them 2025. A lot of programming is already being started. So if you're doing something, please reach out, and Benjamin and his team will definitely help. I'm not going to hold you long, because we're going to get back. We've been talking Kendrick and music and New York. We're not going to get back to our conversation, but I appreciate you stopping in and doing this. And again, 2025, I expect to see you some more, and we have some good times and put some things together.
Yes, sir. Yes, sir. Appreciate you too. Looking forward to collaborating.
No problem. Once again, we appreciate y'all for watching the Guys Guide. Your man BSwift, Benjamin Tapper over here with me. Y'all hold it down. We out.